Well, good afternoon. Welcome to Open Classroom. I'm Janet Gillow, the Director of Professional Development for the Brown School, Washington University in St. Louis. So glad to have you with us for a super important, hastily organized Open Classroom program. I want to thank and acknowledge my friend and co-host, Cynthia Williams, our Assistant Dean for Community Partnerships. She will be helping to moderate the chat and the question and answer session as the program comes to a close. For folks joining us on Zoom, you are muted. We can't see or hear you. We also can't call on raised hands, but we are delighted to have you here and we want you to be a part of the program. So please do send your comments and questions in through the chat while we go. Want to welcome anybody joining on YouTube. We don't have a way of directly interacting, but again, we're very glad you're here. Before we get started today, I just want to let you know what else we have coming up this week on Open Classroom. It's kind of a different week for us. Tomorrow, we're back on at 12:30. Chris Fry is delivering the first of a two-part series on your next move, the when, why, and what of the new retirement. And then Wednesday and Thursday is the thing that's very different for us. We're going to be on 8 a.m. to noon Central Time, both Wednesday and Thursday, live streaming the 5th Annual Conference on Child Behavioral Health in Sub-Saharan Africa. That's the Smart Africa Conference. So if the topics of behavioral health in Sub-Saharan Africa are interesting to you and you're not registered for the conference, you can still be a fly on the wall by checking out our YouTube channel. But now we're going to do today's program, and it's my great pleasure to introduce our speaker. Tim Mcbride is the Bernard Becker Professor at the Brown School. He is an influential health policy analyst and health economist, easy for me to say, shaping the national agenda in health insurance, health reform, rural health care, Medicare and Medicaid policy, and access to health care. Tim studies the effects of health reform at the state and national levels, the uninsured, diabetes policy, Medicare Advantage, and long-term entitlement reform. So you know he's watching the current efforts to fund Medicaid expansion in Missouri with a keen eye. Here to tell us about the long and winding road to Medicaid expansion in Missouri and ask the question many of us are asking, are we there yet? Please welcome Professor Tim Mcbride.
Thanks so much, Janet. And I am having difficulty with, can you hear me? You can hear me. I'm not able to share my screen for some reason. It's just spinning. So, but you can hear me and you can see my video, right?
We can see you. We cannot currently see your screen.
Yeah. Do you want to just share the slides for me?
Okay, it's going to take me a couple seconds to get that going. So if you can begin to speak to the audience, I'm going to pull up the slides and we're going to get there.
Sorry about this.
No, it's good.
Apologies to the audience. We had this all started and it was working fine before we started, but you know, the way technology works, all of a sudden it froze right as we started. So anyways, thank you for being here. And as the title suggests, I was trying to think of something catchy for the title, and I'm a big Beatles fan. So landed on Long and Winding Road, because it has been a long, winding road to Medicaid expansion in Missouri. As you may know, the Affordable Care Act passed in 2010, over 10 years ago. And so it's been over 11 years since that time. And although 38 states passed Medicaid expansion before Missouri, we're the 39th. Missouri's been historically reluctant to expand Medicaid. The legislature has been reluctant to pass it many times, despite efforts by previous administrations to push it forward. And then finally, last August, the voters passed the Medicaid through an initiative and put the expansion in the Constitution in August 4th of 2020. And I know Janet's still trying to pull up my slides, so I'll just keep talking and we'll catch up on the slides. So,
Tim, I've got slides up, and just let me know. I'm on the title slide. Let me know when you're ready for me to move.
Oh, okay. So I'm not seeing the slides, but so you move to the second slide. So this is difficult because I'm not seeing the slides, but that's okay. So the second slide shows Medicaid expansion vote. And then, as I just mentioned, the Medicaid, we were the 39th state to expand Medicaid. And it was a ballot measure that passed in August 4th by a margin of 53 to 47. We were the sixth state to pass a voter initiative. But as far as I know, we were the only state to put the Medicaid expansion into the Constitution, which will become important later as we talk about this. Medicaid expansion passed by about 82,000 votes in the state. You can go to the next slide. It's a little hard for me to tell what it's showing actually, because all I'm seeing, Janet, is your face, but not my slides, but because my thing is still spinning. Next slide sort of talks about what the amendment does. And what's important to realize about this expansion is it's a sort of a clean Medicaid expansion that expands Medicaid for all adults up to 138% of the poverty line. Which I'll show you another slide in a minute to tell you what that means in dollar terms. But the important thing from the state's perspective is we get what's called a higher matching rate. The federal government currently pays about 65%. It's not quite that, but it's roughly that of the dollars of Medicaid recipients. The state pays about 35%. Under the Medicaid expansion, the federal government would pay 90%. So the difference between that is about 25%. And the state would pay 10%. So the state would pay considerably less. The other main difference is currently in Missouri, the mandatory eligibles that are covered are mostly aged, blind, disabled, and pregnant women, and the parents of children up to a pretty low level of poverty, 21% of poverty. And importantly to note here is what that bullet says: single adults and married couples are not eligible for Medicaid. That'll all change July 1st. And so in the next slide, and again, hopefully we're following along with me, the next slide shows the Missouri eligibility levels for Medicaid. You can keep nodding your head if we're following along, Janet, because I can see you nodding your head, but not the slides. So this shows you the dollar amounts and the percentages. The current poverty line is about $12,880, and about $22,000 for a family of three. And again, currently you're eligible for Medicaid at a pretty low level in Missouri, 21% of poverty, among the lowest in the country. And you're not eligible if you're a childless adult. We have a pretty generous eligibility level for children. Like other states, up to 300% of poverty, we are one of the first to pass that level of generosity. Next slide, which should say Medicaid expansion process. What's next? Good, thank you. So the constitutional amendment is pretty simple. It mostly has two steps in it, which is March 1st, the state was required to submit what was called a state plan amendment, which they did. They submitted a document to what's called the Center for Medicare and Medicaid Services, which said how we're going to expand Medicaid. You know, going into the details was actually more than one document, but we'll ignore that. So it was submitted on March 1st. My understanding is they've gotten comments back on that. It's not finalized, but that's in process. Once that's finalized, there's an agreement between the federal government and the state about how Medicaid will be expanded. The other thing the amendment requires is July 1, we open the doors and people sign up for Medicaid. That's coming up pretty soon, about 6 or, of just a few weeks. The other thing that's really important is these words in the last bullet, which says that the state cannot impose any additional burdens or restrictions on eligibility or enrollment for the expansion of population. The way to read that is the way most people tell me to read that is you cannot impose a work requirement on people, and you also have to give the Medicaid recipients the same benefit package as everybody else. On the latter one, the state's already agreed to do that. which was a big step, and they did that right away. They said, we're going to give the new recipients the same benefit package as everybody else. So, and kudos to them and Mo HealthNet for agreeing to do that. And work requirements, the legislature has been wanting to impose that for a long time. There hasn't been a bill, as I know, in the legislature to push that this year. Just pay attention, that may happen. So, but as I read the amendment, that is not in the spirit of the amendment. Next slide says ongoing research, right? So one of the things I wanted to point out to you is our team at the Center for Health Economics and Policy has been doing a good amount of research on what would happen under Medicaid implementation under a grant funded by the Missouri Foundation for Health. And here's snapshots of some of the titles of that, which are available on our website. I'll be pulling up and just highlighting a few of the findings from that in the next slide, but not all of them, and you're welcome to go look at those findings. Next slide, which is a pie chart, right? Thank you. Sorry to be doing this. This is like, Janet's being great. This is a pie chart which shows the number of people that are estimated that will enroll in the first year. The estimate of 274,000 is the governor's estimate that came out of his budget office, and that came out in his state of the state address and his budget. Our estimate was a little different than that, but really within the same ballpark. We estimated that about 60% of these people would come from people who currently have no health insurance, and about 40% of them would come from people that have some health insurance, such as people in the marketplaces, between 100 and 138% of poverty, and some people that have employer plans that are maybe low income part-time workers that might switch over to Medicaid, but a fairly small number. But important to keep in mind here is about 3/5 of that, about 150,000, would come from the currently uninsured. Next slide. What else are we learning about the Medicaid eligibles? There's previous research is showing this from some of the recent expansion states that a lot of people sign up right away. So about half of the expansion eligibles we expect might come in the first couple of months. And there's some complicated reasons why that is. And I could talk about that later if you want. But that's been a fairly consistent experience among the last 4 or 5 states. We also believe that while it's true that the more people will come from urban areas and enroll in Medicaid, a higher proportion will come from rural areas. Let me state that again, a higher proportion will come from rural areas. And the numbers that I'll say is about 1/3 of the people in Missouri live in rural areas, but about 41% of the Medicaid enrollees we believe will come from rural areas. And that's notable and interesting. And it's mostly happening because the rural uninsured rates are lower than they are in, say, suburban areas around urban areas. So that's probably surprising to some people, but that's what the numbers show. We also, in some of our recent research, are finding that we think that the Medicaid new expansion eligible group will be younger probably than the current Medicaid population, a little bit younger, relatively healthy or healthier than the current Medicaid population. So somewhat better health status, somewhat better mental health status. And that's interesting because it might affect your estimates of costs. But it doesn't mean they're going to be completely healthy. They're going to come in with some chronic health conditions and some latent needs. In particular, some access issues. I'll show you a couple slides related to that. Next slide, which says geographic distribution. Here's a map that shows the geographic distribution of people who'll be enrolling in Medicaid across the state. And one thing I want to note, the lighter areas are people where there's a lower proportion of the population that will enroll in Medicaid. The darker areas are where a higher proportion will enroll in Medicaid. And one thing you'll see is the lowest area proportion in the state is around St. Louis at about 3.6%. The highest is in the Ozarks, the central, what's called the South Central area, which is at 8.5%, and also down in the around the south west portion of the state. So, you know, again, that might surprise people a little bit that a lot of the Medicaid recipients proportionally at least might come from other parts of the state, but that's what the numbers show. Next slide on the age distribution. And I mentioned this earlier, but just to illustrate it, again, the new expansion group will be somewhat younger than those currently on Medicaid. Well, 52%, we projected about 52% of the new eligibles will be under 35 as compared to 43% of the current Medicaid population. And this looks only at those 18 to 64, so it excludes the over 65 and the children, which are a pretty big chunk of those on Medicaid. So we're comparing likes to likes here. So next slide. I mentioned the health status of the Medicaid recipients, and this is one slide that illustrates what I mentioned. And this shows on the bottom bar the current Medicaid recipients, and I highlight with a red box the percentage of current Medicaid recipients who say they have fair or poor health status, 24%. And then we projected of the new adult expansion group, we're calling it, about 19% would have fair or poor health status, so somewhat healthier. And among the uninsured, 16%, so somewhat healthier. That's why I said they're somewhat healthier. Probably it's correlated with age and other things. Next slide, same sort of finding when you look at cognitive limitations. 18% of the current Medicaid recipients have a limitation, a cognitive limitation, whereas the new group was 7% will have a cognitive limitation. So again, consistent finding about health status. But yet on the next slide, when you look at usual source of care, that's what you're seeing, right, Jenna, is an interesting finding. If you look at the bottom, the current Medicaid recipients, about 77% report that they have a usual source of care, which means they know where to go to. They know where they go to get to the doctor or an FQHC, or they have a regular source of care. That's also true of the insured population. So say those from the marketplaces, they'll go into Medicaid, but it's not true of the currently uninsured. Only about half of them have a usual source of care. And we have a long line of literature that suggests that one of the problems with the uninsured is they don't have a usual source of care. So there are access problems. So when we think about sort of what might happen as expansion happens on July 1st is there may be some pent-up demand, or there be some transition issues with the Medicaid recipients, particularly the uninsured, as they will need to seek a usual source of care. And that'll probably be mostly those 150,000 or so uninsured. That's why we look at things like this. So that's a really quick tour of some of the demographic characteristics. Let me turn now to some challenges, which is, so there's a slide that says challenges and the next slide that says fiscal impact, right? So, so what about the budget? This is where we're at literally this week in the legislature. But stepping back a little bit, back to January or so, the first step in the budget process is the governor has a state of the state address. And what did the governor do? He rolled out and he said, I have a snapshot of the story. He says, the headline said, Governor Parsons' budget funds, the budget funds Missouri Medicaid expansion without cuts to other needs, which is interesting because That answered a question that was asked a lot during the expansion debate. Could we expand Medicaid without cutting other programs such as education, roads, bridges, prisons, that kind of thing? But the quote that I pulled from the article was from the governor's budget director, where he said paying for expansion will not require Governor Parson to cut any other item in the state budget. Hogg said, for this budget, it's not caused any crowding out issues. My concern is going forward. So in this particular year, he's saying we don't need to cut spending anywhere else. He's worried about the future. And the reason I'll tell you this, to cut to the chase, is we are in a situation that I've never seen in our state. We have a lot of money in our state right now. And I never thought I'd say this in my history of following Missouri politics, and to put that in the same sentence. We have a lot of money in the state budget. The state is, I'll lay this out in a minute, we are rolling in dough right now. So, and then the governor, to his credit, said the following: although I didn't support it, and that's true, he didn't support expansion, he also said, it's now the reality that people voted for it, and I thought it's my obligation as governor to make sure it gets implemented. And he's said that 2 or 3 times, 2 or 3, 4 times. So what is the government, what's the estimate on how much this would cost? About 1.6 billion. Cover again 274,000 people. That's 1.6 billion total. With the 90% the federal government paying for that, the state estimated that their share of it, what's called the general revenue share, is about 130 million after they account for a small amount of savings. We'll talk about that in a minute. But so the state general revenue share is about 130 million out of that total of 1.6 billion. Now, what's really important is that last couple lines. In the interim, after this budget was submitted, the Congress passed the American Rescue Plan, which was put forward by President Biden and then passed by Congress, which creates an incentive to pass Medicaid expansion. And if you pass Medicaid expansion, and you currently don't have it, but if you do pass it, there is an incentive in there of 5 percentage points on your Medicaid federal matching funds that the federal government will pay you as an enhancement to expand Medicaid. Estimates suggest that that would lead to 1.15 billion with a B, 1.515 billion over 2 years for Missouri, because we have not yet expanded Medicaid. So you can do the math. We spend 130 million in state dollars, but if we start Medicaid expansion in July 1, we get 1.15 billion from the federal government just by enrolling. As I've understood, one person, we get to 1.15 billion. So, okay. So next slide. So again, that wasn't accounted for in the governor's budget, and that's not because they were trying to hide it or anything. It happened too fast. It literally was happening at the same time the governor was writing his budget, and they didn't have time to actually put it in the budget. And so a lot of the people who are following this added it up later. And actually, there's another thing that wasn't included, was President Biden actually extended the emergency for COVID, the national emergency, which has increased the enhancement federal matching rate to the end of the year. So they already did this, and they've given extra Medicaid dollars to every state in the country, and we've been getting those dollars. It's one of the reasons we have a lot of money in our coffers right now. And the estimates are that we'll get another $376 million because of that. So we have another 376 million. So we expand Medicaid, we get 1.15 billion. We get 376 million from increased federal matching for Medicaid. That's money that could be used to offset the current Medicaid program. There's even dollars that I'll just mention, but won't talk much about, that I think are not really being counted. Various people have mentioned that we may see increased revenues. I think we will, because the $2 billion that comes in, $1.6 billion or so, is actually revenue to somebody and could be taxed. That's not in the budget anywhere. Other states have seen that tax dollars come in. It's revenue to somebody: hospitals, doctors, nurses, suppliers. They may pay income and sales and payroll taxes on that. I think the savings, in my opinion, are undercounted, but I won't talk much about that. And I also point out that the state started the year with $1 billion in the bank. They started the year with $1 billion in the bank. So, so again, we're getting more money from the American Recovery Act, as we probably should. So next slide. With that as a backdrop, what happened? The slide should say Medicaid expansion legislative challenge. What did the House Budget Committee do? They moved the cost of expanding Medicaid into a separate appropriations bill, House Bill 20, it's called. They did not have to do it this way, as I understand the process. They could have put expansion into the regular appropriations bill, which is House Bill 11. So they could have said, we're going to have 274,000 more people, 1.6 billion, and we're going to add that to our Mo Health Net appropriations and then pass it or not pass it. But they separated it out. Many people saw when they did that, okay, what are they doing? They're probably setting this up to vote against it, which is exactly what they did. They set up House Bill 20, which was the expansion all by itself. Then the committee voted against it, said, we're not going to pass it. They went to the floor. The House Democrats tried several times to put the money back in for the expansion. They failed on almost entirely party line votes and were just not allowed to bring up their amendments. And so it left the House without the money for Medicaid expansion. And as this quote suggests from this article, it left people wondering if there's a different path that they're looking for. So let's look at what the next path is, which is where we are literally this week. So what is next on this long and winding road? So the next slide should say what is next, right? So literally where we are right now is the decision sits in the Senate in the next week or two. And the Senate this week is going to be voting on the appropriations bills from 1 to 12 or so. And again, they are not voting on House Bill 20 because it didn't pass in the House. There's 3 outcomes that I think are possible. They could put the money back in for Medicaid into House Bill 11. That's one outcome. They could say, well, we don't agree with the House, we're going to put the money in. They could ratify the House action, say, we agree with the House, we're basically going to not put the money in, and we'll just pass House Bill 11 as is. And then what happens then? There's 2 possible outcomes. Expansion happens anyways. People start enrolling on July 1. And then, well, that's kind of strange, isn't it? So how can expansion happen without money? Well, I chaired the Mo Health Net Oversight Committee for many years, and the budget was X. And then several months later, they came back and they told us, well, the budget was X and now the spending is Y, and the governor needs to add money to the budget, and it's called a supplemental bill. So they come back in like August through October, November, and they force the legislature to add supplemental dollars. And so that's one possibility, is they may ask for a supplemental bill later if we actually do start expansion on July 1st. Because, and it'll be a big supplemental bill. It'll be like billions of dollars, hundreds of millions of dollars. But that's one possibility people have said may happen. Or expansion won't happen on July 1, and then we go to court. Because remember, it's in the Constitution, and then it goes to court. I'm not a lawyer, so I don't know what the outcome of that will be. I'm just sort of pointing out these three possibilities. Next slide, and then I'll wrap up in a few minutes and take questions. So the next slide says other challenges we've been thinking about, as if that's not a challenge enough. Frankly, you know, there have been a lot of people around the state that have been working on some of the things in these 4 bullets, which are great. And, you know, I just want to put the glass half full story on this. There are a lot of people working diligently and positively on making expansion happen. And they're working on things like enrollment and outreach. Like, how do we enroll 275,000 people? How do we reach them? Who are they? What are the kind of things we need to do to make that happen? And, you know, I will say that includes people in MoHealthNet, includes people in the state government. They've been diligently doing everything to get ready for this, as far as I know. And they are not acting as if this is not going to happen. They've been, you know, from day one, they've been trying to figure out how to do this. And that includes putting in place information technology. This is not a light lift. You know, we're adding 274,000 people. You know, that might involve turning on a lot of switches in your computers, might involve hiring new staff. You know, our state is notoriously understaffed. So the governor's budget includes increasing staff. To the state's credit, they are instituting a new application form, which I highly endorse. We have a complicated application form for Medicaid that's dozens of pages, and it's going to be reduced to way fewer pages than that, and that's fabulous news. And so I give the state a lot of credit for working on that, and they hope to roll that out very soon. And that should make the whole process of getting it on Medicaid better. There are a lot of people thinking about the issue of provider capacity. Do we have enough providers in the state to take care of 274,000 more people? There have been historic challenges around taking care of Medicaid recipients. I have some thoughts about that. It's not the purpose of this talk to talk about it, but I could. It relates back to some of the findings I presented earlier. And, you know, of course, we're rolling out Medicaid expansion in the middle of COVID. And that was not anticipated when the ballot measure was put on the ballot, although in August, clearly we were in the middle of COVID, and it might have affected the vote. And we are now hopefully coming out of COVID, and we were in the middle of the worst recession probably since the Great Depression. And luckily, Missouri, you may not know this, but Missouri's weathered the recession better than most states. We have a 6th or 7th lowest unemployment rate in the country, believe it or not. So that's the good news. So our unemployment rate did not go up as high as, say, Hawaii's or Nevada's. So we did not have to come down. We did not go up as high, so we did not have to come down as low, as bad as it's been. So Medicaid is a safety net program, but nevertheless, we obviously have seen quite a few people lose jobs, and Medicaid is an important program. So next slide, it's important to point out some of the positive things to expect under Medicaid, and there's a huge literature on this, and I have the link to the great summary of this that the Kaiser Foundation has. And there have probably been 400 or 800 articles on Medicaid expansion. And this is just a quick summary of some of the things that other states have found. And again, one of the good things about being 39th is you know what other states have experienced. So other states have seen reduced uninsurance rates, reduced health disparities, improved access to care, improved financial status of hospitals, which is particularly important in our state because we've lost 10 rural hospitals and they're very worried. Actually, there have been improved financial security, including housing security for people who are in Medicaid expansion and positive economic effects. So next slide, and then the conclusion slide is, so as I started this, I said Medicaid was a long and winding road, and we're still on a few turns on the road, clearly. We've taken a few turns in the last few weeks. I'm not really sure what turns we're still going to take in the next couple of weeks until we get to July 1st or beyond. It took a long time to pass expansion. Medicaid, was in the Affordable Care Act in 2010. It was a voluntary decision, but Missouri was 39th state to pass it. I think we're, again, unique in, I believe we're the only one to put it in the Constitution. But challenges remain on that score, as we've seen. So we'll just have to watch what happens. It's obviously still a pretty wild ride. Ready to take questions if you got any.
Oh, Tim, first, thank you for being so courageous and barreling through the technology problems. You did a great job, gave us a lot to think about and some good news to boot. One of the early questions that came in the chat is, will dental coverage be included for adults?
Yeah, so Medicaid includes dental coverage. And so dental coverage was removed in 2005 when Medicaid was cut back. And so, as I mentioned in the amendment, one of the questions was, would the expansion eligibles get the same package or would they get a lesser package? Some people worried that they might get a lesser package, but the state, to its credit, and I sat there in the meeting where it was announced by Todd Richardson, the director, that we've decided to give everybody the same package. So the answer is yes. Now, can you get access to dental providers? That's another question, but.
Yeah. Tim, the question from Gary is there a scenario where Medicaid is not expanded in Missouri? And part B of that would be, and what role would the courts play if that came to the decision?
Yeah, you might want to have another follow-up to this one, or you're bringing a lawyer, because I'm on dangerous ground to not know what, but I'll give it a shot from what I've heard. This is in the Constitution. And, I think July 1st is an important date to watch. If we don't fund expansion in the next week, again, there's three possibilities. The Senate may put the money in, or and then we just go along and we open up on July 1st. But I think the other thing to watch is the state plan amendment, if that's put in place. And then, the key thing to watch is, does somebody try to enroll on July 1st? And if they're able to enroll on July 1st, then that's what happens. But if they're not, then that could be the basis of the lawsuit. But the lawsuit may be filed before then anyways, by the critics of the law. So one thing I didn't mention was there were two lawsuits that were filed against expansion before the vote happened to try to take it off the ballot, but they both failed. And some of the same issues that in those lawsuits may come up in a lawsuit if it comes forward this time.
Well, Tim, thank you so much. We've got an amazing number of questions already from the audience, many of them fairly technical and specific, but the first thing I'm going to ask you is not technical and specific. It's simply, are you okay with us posting your slides to the web page at this point?
Oh, sure, that's fine.
Great. I will throw a link in the chat in just a minute to show people where it will be. Please give me an hour or two, but I know there are people expressing an interest. So I'm going to go ahead and take Taylor's question, case manager at the Area Agency on Aging, and she's asking if he or she is asking, do you know the estimated monthly or annual expenditures per AEG enrollee? trying to get that data from the state and not being able to get it?
I don't know that off the top of my head. I apologize. But I could get that if she sends me an email, he or she. I apologize. Don't know that. So we should be able to get that estimate. And it, it varies heavily very differently by type of person, as you can imagine. The single parent, child, disabled person who's a dual eligible for Medicare, Medicaid, their costs are way higher. And so one of the things that has been quite tricky in partly getting at this question is, are these new eligibles going to come in at the same costs as the current Medicaid eligibles? I'll tell you my hunch about this is they're going to be cheaper than the average Medicaid recipient. And that's partly why we did the analysis we did, because as I told you, they're generally younger. We're finding that more of them are working. They generally have, they do have some health conditions, but they have generally fewer health conditions than the current people on Medicaid. So you add all that up, you're probably going to have if you just put that in an equation, you'll find that generally leads to less health expenditures. So, you would have to model that out, but I think that's probably what we expect.
Tim, there's a question from Jamie. She asked, what accounts for the increase in percentage that the federal government covers after Medicaid expansion?
Oh, I assume she means the federal matching rate going from 65 to 90%.
I would assume so.
Yeah, so in the Affordable Care Act going all the way back to 2010, they strongly, I'll take one more step back. They originally required states to expand Medicaid, but the Supreme Court said you cannot force a state to expand Medicaid. But when the Affordable Care Act was passed, it's a federal state program. They realized that you can't. It would be really brutal to require a state to expand Medicaid and then make them pay 35% of the costs, because that would pass a huge burden onto the states. So the federal government said, we're going to require you to pass Medicaid expansion. And actually in the first 3 to 4 years, they paid 100% of the cost. So if we had expanded Medicaid, it would have cost us $0. And then after that, they passed and they said, okay, we will pay 90% of the costs. You pay 10%. So they're recognizing that if they're encouraging states to expand Medicaid, they should give them dollars to do it. And that's why in what's called an enhanced federal match going from 65 to 90%. And that's why in the current American Rescue Plan, it goes another 5%. And they're sort of really, really encouraging states to do it, at least President Biden is.
Go ahead, Janet.
Oh, okay, so you had mentioned that you can speak a little bit to providers and access to care. It's wonderful to be eligible for a program, but not so great if you can't see the specialist or gain access to the care. I think I've heard that dentists and psychiatrists are particularly challenging, but you had mentioned that you could speak to provider availability, and that's something David would love to hear more about.
So we have been puzzling a lot about that in the last few months. That was one of the big questions that came up. If you're going to expand Medicaid to 274,000 people using the governor's number, will the providers be available? There's been historic, the way I would say it is that providers are less willing to take Medicaid patients than they are most other insured patients. It doesn't mean they won't take them, but for a host of reasons, they appear reluctant to take them. Some providers just say, I don't take Medicaid. patients. There's probably quite a few reasons for that. They get paid less under Medicaid, and maybe some bias, or maybe Medicaid patients are difficult. Maybe whatever the reason is, it just shows up in the data. Knowing that, so people are worried about that. So we thought a lot about that. We looked at other states, meaning actually a lot of this work was done at St. Louis University and our colleagues. We looked at the experience of other states and did they experience shortages? And frankly, actually, they didn't find a lot of evidence that this happened in other states on the cusp of expansion. And one way to think about that is, and that's one of the reasons I showed you that pie chart of who's going to come into expansion. Remember that 40% of the people that are going to come in from expansion already have health insurance. So they already have marketplace insurance. And so they're already enrolled in the federal marketplace plan. So they're already using physicians and emergency rooms and hospitals, and maybe they're using FQHCs, whatever. So they already have a usual source of care. In fact, I showed you that 70% do have a usual source of care. Some of them might come in from an employer plan where they already have a usual source of care. So that group I would look at a little different than the uninsured. What do we know about the uninsured? You know, as I pointed out, about half of them don't have a usual source of care. Should probably be worried about that, but half of them do. So it's not that they don't use medical care. But so I think we are worried about that 150,000 or so. But on the other hand, are they all going to run in the first day? Maybe not. So I can, just to summarize some of our thinking on that, I will say that people are certainly worried about the pressure that'll come on primary care providers. They're probably worried about the pressure that'll come on dental providers because there's a historic shortage of them even now. There's worry about mental health providers, especially in the middle of a pandemic. So I think there's been attention. The good news is you should know there's already been attention played in this 6 months or so since the expansion vote, thinking about how to get ready. And it's not going to be the case that all 274,000 are coming right away. Might be 150,000. But providers are maybe even getting ready to do some hiring. And we've heard this. So I'm not going to say it's not going to be a problem. And there's some analysis being done by the state of where there are choke points, where there are places that it's a bigger problem than it is where there is less of a problem. I hope that helps answer the question.
Tim, thank you so much for working through those difficult questions. And one of our audience members references the American Academy of Pediatrics, and he says that the American Academy of Pediatrics says that the impact of COVID is that 1 in 5 kids have mental health problems. Should we anticipate a coming tidal wave?
That's an interesting question. And I think that's one of the reasons why, in the research we've been doing since August, where you've been particularly thinking about mental health. So in the answer I just gave to that excellent question, I said that, it's not that we're not as concerned about some aspects of the access. I think the ones that we're probably a little bit more worried about is dental care and mental health. And I think we would have been worried about that probably even in the absence of COVID, but COVID raises that even more so because of the reasons that question suggests. We all know that COVID has raised mental health concerns among children and frankly, some of the rest of us as well. And so I think we do need to be concerned about that. But one thing I will point out right away is for children, they're really not in this expansion story because they're currently eligible for Medicaid. up to a very generous level, up to 300% of poverty. Again, I'll point out that Missouri, to our credit, under Kit Bond years ago, was one of the first states to go up to 300% of poverty. And so we have a very generous level of Medicaid eligibility. And in fact, our Medicaid rolls have been rising in the last 6 months. So people have been actually on the rolls and staying on the rolls during the epidemic. And most of the rise has been children. So we are actually already covering some 600,000 kids on Medicaid. So if there is a concern, it's probably already being dealt with or not dealt with. And what's going to happen after July 1st is really adults. That's the new group that's coming in. It's going to be those over 18, those between 20% of poverty and 138% of poverty. So although we need to be concerned about children and the pediatrics group that question raised, it's frankly probably already being dealt with in the Medicaid population, or not.
So Don, who I think may be a CHEP colleague of yours, was curious, the numbers on the sort of return on investment on healthcare premiums. Medicaid is clearly laid out, but he's wondering also about sort of, have you done analysis of some of the holistic benefits to the economy that come from having a well cared for workforce, whether that is workforce participation, a healthier workforce? Have you all had a chance to play through any of that simulation or those numbers?
We have not done it. Well, we have not. Our center has not directly done that analysis because we were asked to specifically look at the state budget. Now, the Missouri Foundation for Health did a study that looked at the economic impacts of Medicaid expansion. So they looked somewhat at the question. So they looked at the impact on jobs of Medicaid expansion. They looked at the impact on the income and jobs, basically, and where those jobs would be located, what kind of jobs would increase. I'm not sure if I would say it completely looked at the holistic aspect that the question's getting at, but it certainly looked at what I might call the first order effect, or maybe the second order effect. Medicaid expansion happens, federal dollars come in, people get jobs because money's flowing in to the health sector, but I think the question's getting at a sort of what I might call a next order effect, which is people are healthier, and down the road they're more productive members of society. I think that's what the question's getting at. I think there have been simulations and studies, longer term studies of that, and are showing pretty positive effects of Medicaid expansion in other states. I mean, we now have 10 years of experience pretty much of Medicaid expansion, almost 10 years. And there are states that are showing that. And I had that one slide that showed that, and there's literature that shows it, and things that people might be surprised at: mental health effects, housing effects, reductions in medical debt. Just by, if you don't have to worry about your health bills, you're less likely to have medical debt, you're less likely to have housing debt. Your mental health is better. And then, the long run health effects take a little longer to play out. But, these are great things to study, and that's also showing up, at least in the short run, in some of the studies.
Tim, can you go back a little bit? And I know it's asking you to think about someone else's thoughts, but you did indicate that The governor did not approve of Medicaid expansion. What are we missing? What was his concern giving all the overall benefits and what other states have realized? What was his hesitation?
Oh boy, that's a tough one. You're right. It's hard to get into somebody else's head. Um, and people have asked me this question a lot over the years. Um, and he's a thoughtful person, and he, and frankly, a lot of this is, and I chaired the Bow Health Net Oversight Committee for 7 years and was on the committee for 9. And, there's, a lot of it is just a pure difference of opinion about the role of government. And I think that's the fairest way to put it, I think, is, there different people really believe differently about what the role of government is and how big the government should be, and whether this is an area where the government should have a significant role. And I think a person like the governor and others just don't believe that this is a place where the government should have a big role, and they believe that it should be left to the private sector and charity. And that's their view. I think there's also, to be fair about it, a concern about the fiscal effects on the state. We are in a low tax state with a Hancock Amendment. If you don't know how that works, look it up. It's very difficult. The state needs to balance the budget, and the person who that lands on is the governor's shoulders. In the end, if the state is in deficit, the governor's got to cut the budget. And the legislature, sure, they got to pass the budget, but if in the end, the governor's got to make the hard decisions. So he may be looking at that. But as I tried to point out to you, there were other years when, I felt sorry for most other governors because they really had to make some really brutal decisions. But, for whatever reason, we're sitting on billions of dollars right now. And literally the federal government's saying, turn this on July 1, we'll hand you $1 billion. And you already got $1 billion sitting there. And so the fiscal one, I just don't really understand. Ideologically, you'll hear conservatives say we shouldn't be taking money from the federal government because it just adds to the federal debt. I'm just pointing that out. That's an argument. What I would say is, well, if we don't take it, then California is, then Illinois is, and Michigan is, and New York is. So, but that is an argument they'll make is, sure, we can take $1 billion from the federal government, but it just is federal debt. But frankly, if I'm paying my federal taxes, and I pay a lot of them, I want some of them to come back to Missouri. So, but so that's my best explanation of what the governor was thinking. And, it's a job I wouldn't want to have. Does that help?
Yes, thank you, Tim. You're always so fair in your perspective. Thank you.
So we are pretty much at time, and so many questions we did not have a chance to get to in the chat. But Tim, as we close out, we certainly want to give you a chance to leave the audience with a final thought. Don't mean to tell you what that final thought should be, but these are obviously people who are watching Medicaid expansion in Missouri. Many of them are involved in providing service to folks that have health care access issues right now. If we care about this issue and we're Missouri voters, what would you recommend we do with our opinion based on the information we have?
Well, I would pay attention literally this week in between now and the 3rd week of May, because this is when we've literally, I called it long and winding road for a reason. This is the long and winding road to expansion. And there's crucial decisions being made this week. So You know, if you have an opinion, make it be heard. You know, even at the end of this week and at the end of the session, that still may not be the end of the story. You know, it may then go to the governor's desk, and you know, it may go to the courts after that. So, you know, I sort of thought, and I took a big deep breath at, you know, August, said, okay, you know, I look back in August, I thought about it, like, when did I first start working on this issue myself? It was 2005. So I've been thinking about this issue for 16 years. But so, you know, this is one of those things that it's going to take a long time for us to get there. And then, you know, we may not know till July 1 if we're really there yet. And we're certainly got a few bends in the road, but pay attention. And it's complicated.
It is, and thank you so much for watching it closely and making complicated things understandable to the rest of us, for being so responsive to everybody's questions. Thank you to the audience for, as always, super smart commentary and questions. We appreciate it. Cynthia, appreciate your help as co-host and general partner in this endeavor. To the folks who were interested in receiving the slides, we are going to post them to the link that I mentioned in the chat. But if you have difficulty finding them, just reply back to the link that you received for this email, and we'll make sure that you get them. So with that, we are at time. Thank you all so much for making today's program possible, and we'll hope to see you again at another Open Classroom